Epilepsy. Know what to do. Epilepsy is a neurological disorder that affects millions of people worldwide. It is characterized by recurrent seizures, which can vary in intensity and duration. In this video, we will define epilepsy and explore the various ways in which you can support someone who is having a seizure. What is epilepsy? Epilepsy is a chronic neurological disorder that affects the brain's ability to communicate with the rest of the body. The seizures that result from epilepsy can be caused by a variety of factors, including genetics, brain injury, infection, or abnormal brain development. Seizures are the primary symptom of epilepsy, and they can take many different forms. Some seizures cause convulsions or muscle spasms, while others can cause loss of consciousness or changes in behavior. There are several different types of seizures that can occur in people with epilepsy. These include focal seizures, which occur in one specific part of the brain, and generalized seizures, which affect the entire brain. What to do if someone is having a seizure? If you are with someone who is having a seizure, it can be a scary and confusing experience. However, there are several things you can do to support them and help keep them safe. The first thing to do is to stay calm. Although it may be difficult, it is important to remain calm and reassure the person that everything will be okay. Try to remember that most seizures are not life-threatening and that they will usually end on their own within a few minutes. Next, it is important to protect the person from harm. If the person is convulsing, try to clear the area around them of any sharp objects or furniture that could cause injury. You can also try to cushion their head with a soft object, such as a pillow or jacket. If the person is having a generalized seizure and falls to the ground, it is important to roll them onto their side. This will help prevent them from choking on any saliva or vomit that may be in their mouth. It is also important to time the seizure. This will help you know how long it lasts and can provide valuable information to healthcare professionals if medical attention is needed. What not to do if someone is having a seizure? There are several things that you should not do if someone is having a seizure. These include: do not try to hold the person down or stop them from moving. This can cause injury and is not helpful. Do not put anything in the person's mouth, including your fingers, to try to prevent them from biting their tongue. This is a common misconception and can be dangerous. Do not try to give the person anything to eat or drink until they are fully conscious and able to swallow safely. When to seek medical attention? Most seizures will end on their own within a few minutes, and medical attention may not be necessary. However, there are certain situations where medical attention should be sought. If the seizure lasts longer than 5 minutes, or if the person has a series of seizures without regaining consciousness in between, this is considered a medical emergency. It is important to call for emergency medical services immediately. Other signs that medical attention may be necessary include: the person has a high fever during the seizure. The person is pregnant. The person has diabetes or other chronic medical conditions. The person has a history of head injury or brain tumor. The person has difficulty breathing or is choking. The person is injured during the seizure. Epilepsy is a neurological disorder that affects millions of people worldwide. While seizures can be frightening to witness, there are several things you can do to support someone who is having a seizure. Remember to stay calm, protect the person from harm, and time the seizure. Seek emergency medical services if the seizure lasts longer than 5 minutes, or if there are other signs of potential complications. It is important to also remember what not to do during a seizure, such as trying to hold the person down or putting something in their mouth. These actions can cause more harm than good. In addition to providing immediate support during a seizure, it is important to offer ongoing support to someone with epilepsy. This can include educating yourself about the condition, encouraging the person to seek medical treatment and take their medications as prescribed, and offering emotional support. It is also important to understand that epilepsy can affect a person's daily life, including their ability to drive or participate in certain activities. Offer support and understanding, and be willing to make accommodations when needed. In conclusion, epilepsy is a neurological disorder that affects millions of people worldwide. While seizures can be frightening to witness, there are several things you can do to support someone who is having a seizure. Remember to stay calm, protect the person from harm, and time the seizure. If medical attention is needed, seek emergency medical services. Offer ongoing support and understanding to those with epilepsy, and remember to educate yourself about the condition. Together, we can help those with epilepsy live full and meaningful lives. Thank you for watching. Please like, share, and subscribe for similar content.